He's an outdoors guy, loved fishing, hunting, was always around family.
A Marco Island man's fate is forever changed after confusion breaks out over who should.
You just wouldn't think someone like that could happen.
Do you think that it was right to let this patient wait for an hour to be transported to somewhere he could be helped?
Tonight, the NBC2 investigators press for answers.
Could a billing battle over who should transport patients to the hospital be to blame for Paul Anderson's death?
Karla Ray asking tough questions tonight, and she's in the studio with this exclusive investigation.
Well, last month we told you Collier County EMS was going to stop transporting patients between facilities owned by Naples Community Hospital. That's because NCH hadn't paid a bill worth more than $170,000. Those transfers stopped October 1st, and just 2 days later, a man lost his life.
Now a captain, as a boy, David Anderson learned how to fish from his grandpa.
I'm lucky growing up next to him, you know, whenever there was a spot on one of his fishing trips or anything like that, I was invited.
When 80-year-old Paul Anderson wasn't on the water, he was with his family, 5 kids and 14 grandkids.
Just enjoyed living and traveling.
Last Sunday morning, Paul felt dizzy. A friend took him to the Marco Island Urgent Care Center, owned by Naples Community Health. It was 12 minutes before 9 a.m., and he needed help.
Yeah, hi, this is Marco Healthcare on Marco Island, Florida, and I have a patient that needs to be transported right away to the main hospital.
NBC2 obtained 911 calls from that morning and dozens of radio transmissions between Collier Dispatch and the county's emergency medical services, who were originally called to respond.
Is this an emergency or non-emergent transport?
No, emergency. Definite.
But EMS was called off.
Go ahead and release my rescue 50 from back home at Marco Island Urgent Care Center. NCH transfer will take it.
EMS Chief Walter Kopka says he was talking to NCH's Director of Transport within minutes of the first 911 call. He was told the healthcare group would transfer Anderson to the downtown Naples hospital, as they are supposed to based on the county's policy.
NCH Transport is certified, licensed to take transports from that facility. And they should be the primary mode of transports from that facility.
Kopka says that conversation happened around 9 a.m. 17 minutes later, a nurse from the facility placed a second 911 call, pleading for help.
Collier County 911. Hi, Marco Urgent Care. We called before. We need a rig over here.
Sources tell us the NCH ambulance was here the entire time that morning. Problem is, the paramedic scheduled to run it wasn't supposed to work until 9 a.m.
But we obtained reports from the Marco Island Fire Department, which also responded that day, in which a witness states NCH's paramedic didn't show up until 9:22 and told him to, quote, back off or she would not transport his friend.
Playing Monday night quarterback that they didn't transfer the patient at a certain time. I didn't know that at that time.
By then, EMS was on scene to assist, but it wasn't until 9:39, 9 minutes short of an hour from the first call for help, that Anderson was on his way to the hospital.
NCH transport took off with that patient upon our arrival. We had no patient contact.
You just wouldn't think someone like that could happen.
Doctors told Anderson's family it was too late to operate. He suffered a stroke and passed away the next day.
We reached out to NCH numerous times. They would not answer any questions about this specific incident.
So, Karla, I got to ask, if this urgent care facility has been around the whole time, why wasn't somebody there to answer this call or to run the ambulance until 9 a.m.?
Right. Well, sources tell me NCH changed their policy the Monday after this happened. They supposedly now start their interfacility ambulance service at 8 a.m. to coincide with the time that the urgent care facility opens. But of course, NCH would not confirm that for us.
All right. Thanks, Karla. And we'll continue to follow this developing story for our viewers.
Outrage over the death of a Marco Island man. County commissioners demanding answers tonight. Paul Anderson died after waiting nearly an hour for an NCH ambulance to take him to the hospital.
You just wouldn't think someone like that could happen.
Now we learn the hospital may have violated its agreement with the county. New information in an NBC2 investigation.
Tonight, Collier County commissioners are rethinking their agreement with Naples Community Hospital.
The agreement allows NCH to transport patients between their facilities, but our exclusive investigation has them questioning that. NBC2's Karla Ray, live in Collier County, breaking new details on the story. Karla?
Yeah, I spoke to all commissioners today, and some of them want to review that policy after seeing our investigation to determine whether the hospital group broke the rules.
Even at 80, Paul Anderson was full of life.
Just enjoyed living and traveling.
A life his family and now Collier County commissioners believe may have been taken too soon.
You never can express your sympathy strong enough to the family that has suffered that loss. Could it have been prevented with a little more care? I'm sure it could have.
The NBC2 investigation into Anderson's death after the man waited nearly an hour to be transported from one NCH facility to another has Commissioner Jim Coletta pushing for a change in county policy.
I'm also going to ask him to bring back the whole procedure, the agreement between us and Naples Community Hospital for handling these ambulatory patients.
Right now, NCH is only allowed to transport patients between facilities because commissioners approved their Certificate of Public Convenience and Need, or COPCN. The investigators obtained a copy of the hospital's request for renewal of that certificate dated November of 2010. In it, hospital officials said they would have an ambulance on Marco Island in service with hours to coincide with the urgent care facility's hours. Something that wasn't happening last Sunday.
When you have many agencies involved in this thing, you're going to have mistakes like that. That's why I fought this fragmentation.
Commission Chair Fred Coyle says allowing multiple agencies the ability to transport patients is a slippery slope.
I think it's ridiculous that it takes that much time to transport someone who is in medical distress to the hospital. It clearly is unacceptable.
Commissioner Tom Henning called the issue an emergency via email today, stating he will not support NCH's license to transport again. Changes that won't bring back Paul Anderson, but may prevent a situation that led to his death from happening again. I also spoke with Commissioners Fiala and Hiller. They both said that they need time to investigate this, and they're asking for county staff to look into it. Meantime, county staff has already changed EMS protocol for the meantime until they can figure out a permanent solution with NCH. EMS will respond to all emergency calls at Marco Island Urgent Care to help triage patients, and then they will figure out who should transport that patient between the agencies. Live in Collier County, Karla Ray, NBC2.
The Marco Island fire chief calling for a state investigation tonight following the death of a Marco Island man who waited 54 minutes just to be taken to the hospital.
Chief Michael Murphy filed a complaint involving Naples Community Hospital, Collier County EMS, and even his own department. This after confusion over who should transport the elderly man to the hospital. NBC2 investigator Karla Ray broke this story, and she is here with new details tonight. Karla?
Well, in a 65-page report obtained exclusively by NBC2, Fire Chief Mike Murphy takes aim at all of the agencies involved, telling me the system failed.
Before 80-year-old Paul Anderson died, he had his last dinner with his grandson.
It was just a shock. I mean, it was almost 12 hours ago I'd seen him. I just didn't almost believe it. I don't think any of the family believed it.
David Anderson saw his grandpa for the last time at Naples Community Hospital, told it was too late for surgery after the man had a stroke. What David didn't know, it took nearly an hour to get an ambulance to take him there from NCH-owned Marco Island Urgent Care.
But there is an ambulance station there, and the ambulance wasn't staffed in accordance with their COPCN requirement.
NBC2 uncovered NCH is supposed to have a paramedic on staff during hours that coincide with the urgent care center's hours. But the Sunday Paul Anderson was taken there, a paramedic wasn't scheduled to work until an hour after opening. And according to reports, that person, paramedic Lori McKenney, showed up 22 minutes late.
And I'm not clearly pointing the finger at NCH in this issue. There are multiple failures to the system that resulted with this case.
Murphy compiled those failures into a 65-page complaint, which he sent to state investigators this morning, calling out multiple agencies, including NCH, EMS, even his own department.
There potentially were violations of a COPCN. There were potentially violations of a duty to act in response to 911. And I think our citizens deserve an answer.
In the report, he also questions whether NCH's transport vehicles are properly equipped and points out protocol that may have slowed the process down, including more than 20 questions dispatchers asked during the second 911 call before sending an ambulance.
In this case, there were 2 911 calls made. There's an expectation of service. We need to fulfill that expectation.
Now, county officials wouldn't comment today as they actually haven't even received the complaint yet. But Chief Walter Kopka told us last week EMS didn't respond after the first call because NCH officials said they would do the transport. When EMS got to the scene after the second call, the NCH paramedic had shown up at that time. Lindsay.
Karla, you've been following this for quite a long time. Any other agencies that you know of investigating this case?
Yeah, we have actually confirmed that ACA, the Agency for Healthcare Administration, has launched an investigation into NCH and made visits to the Marco Island Urgent Care Center this week. We don't know, though, when that investigation was launched or if it is directly tied to this case.
This one not going away anytime soon.
No, we'll continue to follow it, of course.
All right, of course. Thanks, Karla.
Breaking news at this hour. Naples Community Hospital has fired its transport paramedics and given up its ability to move patients between facilities.
This all comes after a man died after waiting 54 minutes to be taken to the hospital. NBC2 investigator Karla Ray broke this story, and she joins us now with exclusive new details. Karla.
Well, Naples community health officials sent a letter via email to the Collier County manager this afternoon saying they will no longer provide those transport services for their patients. We obtained a copy of that letter. In it, Dr. Alan Weiss, the CEO of NCH, writes the change is effective immediately. With the healthcare group relinquishing its certificate to transport, Collier County EMS will have to transfer all emergency patients between those hospitals. The memo comes a little over a week after our investigation into the death of 80-year-old Paul Anderson. He was taken by a friend to the Marco Island Urgent Care Center on October 2nd. That urgent care center is owned by NCH. It took 54 minutes to be taken to an NCH ambulance to the hospital in downtown Naples. His family members tell us doctors told them, but by the time he got there, it was too late to operate on him. He had suffered a stroke and he died the next day. Now, because of all this, we've also confirmed with NCH transport employees that the entire department was let go after this change. We tried reaching out to NCH for comment, but no one has returned our calls. We will, of course, stay on top of this story as there will be more developments. For now, Karla Ray, NBC2.
Naples Community Hospital is fighting to keep its Medicare provider status after investigation finds conditions that pose, quote, a serious health threat to patients.
This is on the heels after 80-year-old Paul Anderson died after waiting more than an hour to be taken by NCH transport to a hospital.
NBC2 investigator Karla Ray broke the story and is the only reporter to get her hands on this new report. And Karla, this is a pretty scathing report.
Absolutely. The Agency for Healthcare Administration logged more than 30 pages of deficiencies. While most of the extreme issues have been fixed, more inspections are coming to make sure what happened to Paul Anderson doesn't happen to anyone else.
Paul Anderson was a family man who loved spending time on the water with his grandson, David. On October 2nd, the 80-year-old felt dizzy and went to Marco Island Urgent Care for help.
You just wouldn't think something like that could happen.
Anderson waited more than an hour to be taken to the hospital. The paramedic running the Naples Community Hospital ambulance showed up 20 minutes late to work, and an EMS engine was called off by NCH's transport director. We now know, in addition to those delays, hospital staff in charge that morning violated state statute by not transferring Anderson to the closest hospital. According to the Agency for Healthcare Administration's investigative report, the doctor in charge requested Anderson be taken to Physicians Regional Hospital, but staff were not aware of Florida statute and hospital policy, which required emergency transfers to be taken to the closest hospital.
Yeah, hi, this is Marco Healthcare on Marco
So they
Island,
took Anderson
Florida.
6 miles further away to NCH's downtown facility, where he later died.
You never know. It at least gives you a shot to be with doctors and in a place where they can take care of you.
ACA visited Marco Island Urgent Care multiple times following Anderson's death. On October 19th, investigators found no personnel near or in the facility's ambulance during its hours of operation. And during a follow-up phone interview, no one could verify whether they were even in the building.
The Centers for Medicare and Medicaid Services sent this letter a few days later, letting the hospital know that they posed a serious and immediate threat to its patients and that the hospital would no longer qualify as a Medicare provider.
NCH has since given up its ability to transport patients, and according to a second ACA report, the hospital is no longer being threatened with its Medicare partnership. But they do say there's continued noncompliance, which could jeopardize their partnership in the future.
Now, NCH told us in a statement today that they have worked diligently to address and resolve the matter. They also told us that all of the deficiencies were corrected a few days after the second ACA report was filed. That's true on a federal level, but ACA officials tell us again there are still state deficiencies which they plan to follow up on. We will as well. Live in the studio, Karla Ray, NBC2.